Strachan. I'm a doctor. I trained in Jamaica. I grew up, I was born in Jamaica in Kingston, and went to high school there, started university in 2005, finished med school in 2010. And since that time, I've really been, practicing medicine in different places, doing different specialties, primarily orthopedics, but because of the nature of medicine in Jamaica, you're actually able to rotate through so many different specialties. So on top of doing orthopedics, I was able to do some cardiothoracic surgery, a long time in the emergency department, some pediatrics, sports medicine, but orthopedics is primarily what I did, and it's pretty much what I'm doing here since I've been here for the past 2 years. So at Expert Institute, I'm a senior medical research associate. So we are the physicians who basically do the case clinics, evaluate the records that attorneys send in, to help them to find out whether there is, any standard of care departures, if there is causation, liability, and leading to damages. So my role is to help attorneys figure out whether they have anything or not. Lots of the times it's about vetting, helping them vet the cases so that they know whether there is any merit to it or not. And at other times it's more about helping them figure out the particular strategy that they want to use. So in this role, there are just so many different things that are necessary. So it's requiring a lot of medical knowledge as well as being able to learn some law that you'll pick up from the clients and learn how to kind of bridge the two disciplines. With the case clinic process, what it involves is we get the records. So we go through all the records. We want to know what the attorney would like out of the case clinic beforehand. Most of the times it's a merit review. So they want to really know if there's a standard of care departure or not. So based off of what we know, we'll go through the records, at times thousands of pages of records, to be able to figure out almost like a chronology of what's happened and then figure out why. Once you get the why, you want to know, okay, did this why lead to something else? So it's a very holistic review, but it's not just the medicine alone. There's a great portion of it that's about the customer service itself, so it involves you knowing the clients. So you have to know if this attorney is one who is extremely risk averse, or does this person want to go to, all lengths to figure out whether there is a case or not. So it's going to require you to know the demographics of who you're working with, and almost not necessarily their pain points, but you have to know what they want, what really makes them tick. Not every attorney is going to want cases that are very difficult to litigate, because that's a lot of money going into it, and a lot of the times it's kind of 50-50. There are attorneys who just want slam dunk cases. How will you know that? The only way to know it is after spending a lot of time with the different attorneys, talking to them, having an idea of their background, so the cities that they're from, and what they want out of it. So there's a lot that goes into the entire process that we're able to simplify and condense into a very, digestible form for the attorneys. What I find attorneys find most valuable is to be able to use us as a screening tool for their cases. On my first day here at Expert Institute, I remember an attorney saying that I don't make my year by my $1 million settlement that I managed to win, but I can lose my year if I dump $300,000 into a case and it gets thrown out. So with that mindset, I realized that the value that we give is in being able to screen this case to figure out whether it's worth the hours, the manpower, and the money that you're going to put into it to take it all the way. So that's one way that I think is a major thing, but there are other things as well. Another thing I'll bring up is they use us to help to develop their strategy and know the causation links. So they want to be able to say, okay, they know that there is the standard of care breach, but how do we link that to what happened to the patient? So that's what we help them to figure out, because we know the medicine, they know the law. Now, they've been doing law for longer than most of us have been doing medicine. So they know quite a bit, but they don't know the intricacies and the fine details often. So our job is to really help them figure out what's best, what works, how do these two things link, and then that helps them to move forward. So I routinely work on orthopedic, spine surgery, and sports medicine cases. I would say what I see the most are spine surgery cases. So your lumbar discectomies, your lumbar fusions, your ACBF surgeries, and the complications from it are what attorneys bring. So the post-operative infections, people who have worse outcomes, so they get the surgery and absolutely no relief. Of course, everyone's going to think that the surgeon did something wrong, but that's not necessarily negligence. So it's really being able to kind of go between the two and understanding that there is a fine line between negligence and a bad outcome. So I see a lot of spine surgery cases because anyone with a bad back usually needs to get evaluated at some point. I see a lot of hip replacements and knee replacements as well. I'll put those as second and third on the list. And for hip replacements, it's a lot of foot drop after hip replacements, and that's something that attorneys and I routinely go back and forth about as I try to explain to them why this is or is not a standard of care breach, knee replacements, and infections as it affects both of those. I mean, I do a lot of arthroscopy, so knee surgery for athletes, ankle surgery, shoulder, but I think those three, the spine, knees, hip replacements, those are the three top ones that I see. So I had a case with an attorney a few weeks ago where he was exploring both the product liability and the medical malpractice angle. So there was a recall on the exact device that was being used for the knee replacement, and this was the Exactech recall, which came in February of 2022. So the attorney brought the case because this was recalled at the time, and he wants to know if there's any link in terms of the complications that the client had and the recall device. Now, the recall device was because of oxidation, so packaging issues, and this led to the breakdown of the arthroplasty device, and that could cause instability with the knee, and that in itself led to the bad outcome. So with that now, the surgery for the revision which was necessary, there were many complications from it. So I was able to discuss with the attorney that we can't go after the medical malpractice because there really is no standard of care departure. The surgeon did everything by the book and the complication is known and recognized. However, we do have a strong product liability angle here because the issue that led to the recall is why she needs the revision, why she got complications. So it can be said that everything from that device is responsible for the complications. The attorney was extremely pleased with it to the point that he wanted to, or I think he's already started to advertise in his local newspaper so that he's able to get enough clients together who've had poor outcomes from the knee replacements and turn it into a class action suit. Now, the hope is that the class action, we get to vet the different patients so that we're able to say, all right, this is a known and recognized thing, so this should be a part, so we're also able to help with that, and that's another angle and thing that we like to do. So, with the case clinic model, it has to be understood that it's not what it was, say, about 4 or 5 years ago. What it is now is such a holistic process. It takes into account so many different things. So it's not just going through records and regurgitating the things that you yourself as a client are already able to pick up. Now you're understanding the why and the how. And when you understand those, you're able to do multiple things. You can decide, all right, I want to move forward with this. Here is how I do it. Or if you want to decline it, you have all the reasons to know why you need to decline this case, why it's not a good case to go through with. Or if you think there's one aspect of it that you'd like to just harp on and you think that you can win this, we can help you to develop the thoughts around it and also help you to spot the landmines ahead of time, because we will know what they may come with and which parts of it will be defensible. So we will try to guide you to evade those landmines. So it's a very holistic process. There's so much to be done. The team itself is so specialized now with so many physicians. So it's a very good use of resources to invest in the product, just because you're always going to get good value from it.